Welcome to Sleep Better TV. I'm Tasia Custodi, and my guest today is Dr. Dawn Slayback of the Craniofacial Care Center in Columbus, Ohio. Thank you so much for joining us again, Dr. Slayback.
Thank you for having me.
So let's talk a little bit about obstructive sleep apnea. First, what is obstructive sleep apnea, or OSA?
OSA, again, it stands for obstructive sleep apnea. It's basically when a person stops breathing for 10 seconds or more while they're sleeping due to some kind of blockage in the airway somewhere.
And what causes OSA?
Again, it's some kind of mechanical blockage in the airway, a blockage behind the nose, behind the palate, behind the tongue, or even below the lower jaw. Something, it's like a roadblock in there that's just not letting air get through there, most commonly the tongue.
So then, what are some of the symptoms of obstructive sleep apnea?
Well, first and foremost, they may snore. About 90% of patients with OSA snore. That's usually the first sign. They may be witness stopping breathing. Their bed partner might be freaked out because they hear their husband or their wife stopping breathing, and that's what finally gets them motivated to do something about it.
And how is OSA diagnosed?
Obstructive sleep apnea can only be diagnosed by a medical doctor. It can be diagnosed by a full in-lab sleep study called polysomnography, or PSG for short, usually done in a hospital or a laboratory setting, or more commonly and more popularly used now are home sleep tests that are, again, administered and read by a medical doctor to make the diagnosis.
So this sounds like a really serious problem. What are some of the treatment options for OSA?
The gold standard for many, many years is what's called CPAP, or continuous positive airway pressure. It's basically a breathing machine that forces air through the nose via some sort of mask and tube configuration that opens up the airway by blowing all the tissue out of the way, the mechanical or the anatomical tissues out of the way, to open up the airway. That's been the gold standard for years, and in fact, most people will be expected to try that before any other options are given to them. There are some surgical options. They have some limited level of success in that unless we're addressing every site of obstruction surgically, they're not successful. If all the sites are addressed, then they can be successful. And then the third one that most people like the best is oral appliances or a dental device. It's like a retainer or a mouth guard specially designed to bring the jaw forward, open up the airway, and stop the apneas at night.
Thank you so much for your time, Dr. Dawn.
Thank you.
My guest today has been Dr. Dawn Slayback of the Craniofacial Care Center in Columbus, Ohio, and you have been watching Sleep Better TV.